Paternal factors and embryonic aneuploidy of paternal origin. I think this is again a common question, isn't it? That when you get abortions or not a blastocyst form or repeated aneuploid blastocyst, the couple keeps asking you or the husband keeps probing, is there something wrong with me that we are having these aneuploidic pregnancies, or is it something wrong with any of my semen factors? And this particular study did semen analysis. They went for IVF, they did a blastocyst analysis, did a PGTA, but they used a technology of SNP arrays wherein they correlated the what is expressed in the semen and those with the embryo, and they correlated them. So from the embryo SNP array analysis, they would know whether the aneuploidy which they are looking at is of maternal origin or paternal origin. So overall, of all the aneuploidic embryos, about 9.9% of the aneuploidy is of paternal origin, and male obesity has beyond 42% and decreased sperm concentration, motility, and increased SDF. All those things were also tested. They looked at the semen parameters, and what do they say? That euploid tested embryo, their embryo samples were also compared to those of the semen SNPs. After 435 IVF cycles with 1720 embryos were biopsied, 48.9% with euploid, 49.9% aneuploid, about 1.2% of the patients there was no call of aneuploid or euploidy taken. And 73.7% aneuploidy, often the aneuploid embryos were of the maternal origin, while 8.4% were paternal origin aneuploid. And this diagram talks about what is the maternal contribution to aneuploidy and what are the aneuploidies because of paternal origin. The rate of embryonic aneuploidy was not associated with any semen problems like oligospermia, asthenospermia, or with teratospermia, or anything wrong with the progressive motility. None of these factors had any relation with the paternal aneuploidic reasons. Even in TC sperm, when you use TC sperms, the chance of having an aneuploid, paternal origin aneuploid, was only 7.7% lesser than the average of 8.4% seen in the study. They looked at the paternal BMI and the body mass index, and well, there was a very small correlation that as the weight of the male increased, the aneuploidy also increased, like 7.2% paternal origin of embryonic aneuploidy in a normal weight man, and 8.4% in overweight, that is BMI around 30, and 9.1% obese, BMI beyond 35. So this could be one of the reasons which needs to be explored further. What about the age? Yes, age did correlate. In men less than 50 years, the paternal aneuploidy contribution was 8.2%. Men beyond 50 years, it was 13%. But probably, I think having a cutoff of 50 years is not something we desire in our study. So I don't think this particular inference is of any clinical relevance to our day-to-day practice. Overall, there is no statistically significant association of male age, BMI, and semen parameters with paternal origin of embryonic aneuploidies. The only sperm which resulted in an embryo is evaluated here, isn't it? You are originally looking at the paternal aneuploidy, but that particular sperm which went in. But when you talk of age and BMI and let's say paternal smoking, etc., they are very general factors. So they would affect the semen parameters in general. But the selection process, what goes into the egg, must be very selective. And believe me, I must correct myself. This is a study of IVF and not of ICSI. So it is an operator selected sperm. It is a nature selected sperm. So in spite of having the semen parameters deranged or the age of BMI, we think that it could be affecting semen parameters. The selection process must be having some specific reason there that a good sperm enters, and the paternal aneuploidy by nature itself is kept quite low. And suppose even if there is an aneuploidic sperm entering and forming an embryo, that would lead obviously to an embryonic aneuploidy. And this embryonic aneuploidy of paternal origin will be there, but the embryo will not survive. So it may not lead to a viable embryo. So this could be another factor why the paternal origin of embryonic aneuploidy is very late. And in this particular study, they had used an SNP macroarray platform which gives an insight into paternal or maternal origin. And most important information again is doing a TISA does not make a difference. So I think the take home message from this is, we dwell into doing SDF levels, DNA fragmentations, or if the DNA fragmentation is high, we go for TSAs and etc. We keep on intervening, and probably whether looking and advising the couples, well, this could be the reasons of the paternal insights or origins of aneuploidic embryo. Probably that is not there. I think what we need to counsel the client is having an euploid embryo is a random chance. And are you willing to take that random chance with us?